At a maternity unit in Warwickshire, baby Alan has just entered the world. His parents are Polish, mum Eliza among tens of thousands of young Poles who came to work in the UK when the EU expanded.
Many other women, you know, like young, older, coming here with babies or without, just planning to have children or getting married. So, yeah, many.
You got all your kicks over here.
Such is the demand that midwives in the area now put on fortnightly antenatal clinics just for pregnant Polish workers. But it's not just Eastern Europeans who've pushed up the birth rate. Official figures show that almost a quarter of new babies in England are now delivered to mothers from overseas. What we can reveal from our analysis is that in the last decade the cost of NHS maternity services for foreign-born mums has risen to £350 million a year, a £200 million increase from 10 years ago. Here in Slough, every other baby is now delivered to a mum born overseas. The result has been hundreds of extra babies a year, which doctors had not been expecting. Last summer, the local health trust was forced to take drastic action. It was announced that this maternity unit, 10 miles away in Ascot, would be shut down for 2 months.
Now, the hospital at the time said the closure was due to an unprecedented 9% increase in the annual birth rate. So they had to move midwives from here over to the pressure point in Slough.
The impact of the closure rippled down the Thames Valley. Little Charlie Cooper was supposed to have been born in Reading last August, a mile from her parents' home. But when Mum Lavina went into labour 2 weeks overdue, things started to go wrong.
Basically got turned away, and the reply I got on the phone was, wherever you ended up is where you end up, whether it's Slough or actually, you know, there's other hospitals which are shut as well, so it could have been anywhere.
In the end, Charlie was born by emergency caesarean at a hospital in the neighbouring county of Hampshire. Their local hospital has since apologised. Our research finds the number of babies born to British mothers down by 44,000 a year over a decade. Births to foreign mums are up 64,000, pushing the birth rate to its highest level for 26 years. In 2006, there were 15,000 more Eastern European babies born here than a decade before. 11,000 more babies from the Indian subcontinent. 8,000 extra babies from African-born mums. Peterborough is a town which has seen a rapid increase in new migrants arriving. This clinic says the young women who've come to work from Eastern Europe has dramatically changed their workload, births up by a third in just 2 years.
Hopefully somebody who's in authority is actually looking at the figures to try and work out how they're going to cope with the influx and, you know, more people coming in with more countries joining the EU.
The story in London, where inward migration has been at its most intense over the past decade, is even more marked.
It is perhaps an extraordinary sign of our times that in central London, most babies, 6 out of 10, are now delivered to foreign-born mothers. Here in Newham, the figure rises to 3 in every 4.
Births within migrant groups can often be more difficult, more dangerous and more expensive. Higher rates of diabetes, TB and HIV, say doctors, help explain why maternity services in multicultural London come out so poorly in performance tables.
The sheer numbers has in some areas increased very substantially without there being any forward planning really to allow for that. If we're encouraging people to come to the UK, then we have an ethical duty to provide a proper standard of care.
The timing of the impact is much quicker than we had anticipated, and therefore we are working with our commissioners and our maternity providers now.
There is an irony in this. The NHS could not function without the use of migrant labour. And yet our research reveals the failure of officials to plan for immigration's impact on the NHS itself.